you or a loved one have been diagnosed with post-traumatic stress disorder, you may be entitled to financial compensation. Where a child is in terms of their development prior to their trauma is a significant factor for how well they can handle it. Adolescents are at a greater risk of undergoing trauma due to the fact that they have more connections to the world outside of their family. It is due to their stage in development that makes adolescents more vulnerable because they understand the significance of the trauma as it is occurring, as opposed to younger children. Young children's lack of understanding has the ability to protect them from trauma by keeping them from fully processing the significance of what they have experienced. PTSD affects the physical makeup of the brain, therefore affecting a child's skill and relationship development. The corpus callosum is the bundle of nerve tissue that connects both hemispheres of the brain, allowing for a smooth flow of communication between the hemispheres, and can be damaged by PTSD. The reduced size of the corpus callosum interrupts the development of skills such as self-regulation of emotions and behaviors, coping, and social skills, which may drastically undermine personal and interpersonal functioning. The volume of the hippocampus, which stores long-term memories, reduces significantly in patients with PTSD, causing problems with verbal declarative memory. The support of the community as well as the caregiver is critical for the recovery of a child who has undergone trauma. A supportive relationship between the child and their community allows for the child to feel the safety that is necessary for them to deal with their trauma, to desensitize their traumatic memories, and reintegrate their identity. Researchers have found that community acceptance was a key protective factor for adjustments of child soldiers after their return to the community. Without the community's acceptance, the children have a much harder time adjusting to their current reality. The best solution to treat a child with PTSD is through the use of multiple strategies, including the arts. Due to the naturally expressive quality of the arts, with the use of an artistic outlet, PTSD patients are able to develop the feelings of safety, attunement, and emotional support, while at the same time strengthening their ability to deal directly with their traumatic memories. Gradual exposure should be used to allow the patient to develop a sense of control over their symptoms and overwhelming feelings, therefore making them feel more grounded in a world that has left them afloat. As traumatized children get older, the effects of their PTSD carry on into their adulthood. Adults who were exposed to trauma in their childhoods have reported higher and more frequent levels of chronic pain. As the symptoms of PTSD get triggered initially, the immune system in children may not develop normally. Therefore, in their adulthood, these individuals are much more likely to develop chronic illnesses, such as cancer, and live much shorter lives than their unaffected counterparts. Therefore, if you or a loved one has been diagnosed with post-traumatic stress disorder, call 1-800-PTSD to find out if you are eligible for financial compensation. That is 1-800-PTSD.